Hi, I am Dr. Deepak in Inamdar. I am a senior consultant orthopedic and robotic joint replacement surgeon. Is robotic surgery a better option for you? See, I do robotic knee replacement for most of my patients. The only patients wherein I don't do robotic surgery is for a very old and very frail patient in whom I feel the bones are osteoporotic. Otherwise, most patients I feel do very well with robotic knee replacement for the reason that you get excellent alignment, a real-time balance and a beautiful post-op recovery. The recovery is seamless and quicker compared to non-robotic knee replacement surgery. The best part of robotic knee replacement surgery is its reproducibility. That means in every patient you get the same post-operative X-ray despite having different deformities of the knee pre-surgery. So this reproducibility is a very important part of knee replacement surgery. So this is the best part of robotic knee replacement surgery. Definitely seeing the patients, there is lesser pain compared to robotic surgery compared to a non-robotic, as there is less tissue dissection, less tissue trauma, less tissue handling. This translates to a comfortable patient. The more we handle the tissue, the more pain to the patient. The less we handle the tissue, the less pain to the patient. Robotic surgery helps us to plan and put in implants at the desired levels and position. We can do a lot of tweaking with respect to the positioning of the implant, which is not possible with conventional surgery. So yes, it is definitely less painful. The success rate of robotic knee replacement surgery is very good. It is as good as the conventional knee replacement surgery. The complications with respect to knee replacement surgeries are uniform, be it robotic or non-robotic. The same list of complications are there. So one need not hesitate thinking that robotic surgery has got a higher risk or a higher list of complications. The cost of robotic knee replacement surgery in India is extremely nominal compared to the West and US. We have kept a very nominal rate. Please contact your doctor. It is made very affordable for the Indian population compared to the costs available in Europe or in US. It's a fraction of the same. So one need not hesitate or fear for the high cost, the so-called high cost with respect to robotic knee surgery. Please get in touch with me and we will try to give you a very reasonable and a comfortable rate for suiting your budget. There are a lot of advantages of robotic knee surgery. As I have told earlier, one is excellent accuracy, 2 excellent alignment, 3 excellent balance, 4 you can pre-plan your surgery and plan the whole procedure before you get into the surgery. And the most important thing is you have a real-time feed while doing the surgery. So this gives you a lot of information from the computer to the surgeon, which helps in being more accurate during the surgery. The only cons I can think of is one is a little more prolonged duration of the surgery compared to a non-robotic one. The second thing, in an osteoporotic bone, there is a small risk of fractures, especially in the very old patients in whom the bones are softer. So these are the only risks which are seen in robotic knee replacement surgery. Coming to robotic knee replacement surgery, robotic knee replacement surgery is done using 1, a camera, 2, a tracker which we put into the bone during the surgery, and 3, a robotic arm. So the camera recognizes the trackers which we put into the bone and gives us the position sense of the knee. Not only it gives us a position sense, we create a 3D model of the knee during the surgery, and this helps us to plan the surgery and we get a real-time feed. So as we continue into the surgery, every step along the way we get a continuous feed from the computer as to what is happening to the knee we are operating. So in the end, the surgeon gets a lot of information which helps in planning and executing the surgery to perfection. So robotic surgery scores over conventional surgery, wherein it is done based on the surgeon's experience and instruments which are cruder. This accuracy in alignment and balance is to 1 degree or 1 millimeter, which translates to better results for the patients and better longevity in the long term. Hence, robotic surgery scores over conventional or non-robotic surgery as a form of knee replacement surgery.